think people understand that nurses need to be appreciated, need to be paid a proper wage, but I think where we can draw the line is a strike. I think most people want to be seen by their GP, seen at their hospital, and unfortunately the services that will be affected are those community nursing services. Things like cancer treatments will be delayed, even though some of the services will go ahead, and of course emergency care will still be there. So I think it's a really tricky one for the government, because you don't ever want to appear unsympathetic to those people that we all stood out there and clapped for. But on the other hand, the unions asking for a 5% above inflation rise is unrealistic and just puts them on that collision course with the government.
If they'd gone for something much more reasonable, Claire, 17%, completely unrealistic. That would be £9 billion. That's got to come from somewhere else, because it's public money, taxpayers' money. Might there be more sympathy, do you think?
I think there would be more sympathy. I think everybody has sympathy. And the problem is when you start to look at finances and say, well, where are you going to get the money from? Where's it coming from? You get the argument back at you, well, the government can find money for things like HS2, PPE contracts and all of those other things that the government has spent money on, and wonder why you can find that. You can find money for a yacht, which was a vanity project, but you can't find it to fund nurses. And I think that's the real difficulty, is trying to understand where the public fit in all of this. They don't want to be affected by strikes. They want people to be paid fairly. But that unrealistic expectation of sort of 17% just knocks it on the head.
I wonder as well if the government are thinking about the PR strategy here, because Steve Barclay, the new health secretary, he's done this audit which is exposing more and more increases in numbers of middle managers, and only the other day the audit exposed hundreds of NHS bureaucrats, they're not involved in providing medicine, earning more than £100,000, some of them earning £260,000. People watching this will think, no, they don't. If they got rid of that whole raft of bureaucrats, the NHS probably function perfectly well, and that money could go directly to help nurses or to cut waiting lists.
But I think there is an argument now to look at wastage in the NHS as a whole. You need to look at the entire institution. Its buying powers should be better than they are.
Of course.
You shouldn't have as many middle managers. It needs a proper root and branch review. But politically, that is such a hot potato. Anybody that goes anywhere near it gets accused of either trying to sell it off or privatise it. But I think people are more coming round to the fact that it doesn't work at the moment. It is overloaded.
I think the problem is, if you don't pay nurses properly, they won't stay in the profession, and then you create a greater problem within the National Health Service. And there has to be an acknowledgement that there is a problem with retention. There is already a problem with shortages on the wards, quite frankly, very often at unsafe levels, where patients are already facing their lives in question.
Yeah, and I think we ought to look at perhaps how we train nurses, the degree process. Do we need this sort of level of a degree? Because most people who are nurses are so acutely good at what they do, and they care and they have empathy, and the practical side of it, they're excellent. They don't need a degree to do that. So I wonder if that perhaps puts some people off wanting to be in the nursing profession.
I think they also have to pay a lot of their own training costs.
Yeah, they do, and that puts a lot of people into debt when they can least afford it. So I think we all need to look at where that goes from here, and hopefully Steve Barclay will start looking at that and looking at the retention issues, because you're quite right. The reliance upon agency staff is enormous in the NHS, and you can understand why some people would look to agency work to earn more money, but that doesn't help the process in hospitals and in the community at this time.